Multiple myeloma. Multiple myeloma is a plasma cell malignancy characterized by uncontrolled proliferation of plasma cells in the bone marrow. This leads to reduced hematopoiesis of other blood cell lines, causing anemia, thrombocytopenia, and leukopenia. Abnormal plasma cells also produce monoclonal immunoglobulins and free light chains that contribute to complications such as renal impairment, hyperviscosity, and bone destruction. Precursor states: monoclonal gammopathy of undetermined significance, MGUS, approximately 1% annual risk of progression. Smoldering myeloma, asymptomatic but with a higher risk of progression. Peak incidence. Most cases occur between 50 to 70 years of age. The disease course is typically relapsing and remitting. Symptoms. The acronym CRABBY is commonly used. Calcium elevation, hypercalcemia causing nausea, abdominal pain, renal stones, bone pain, and psychiatric disturbance. Renal impairment, anemia, bone pain, bleeding secondary to thrombocytopenia, and infections due to leukopenia. Additional symptoms include fever, night sweats, weight loss, and paresthesias or spinal cord compression in advanced cases. Signs: pallor, bone tenderness or deformities, commonly back pain, increased risk of fractures, vertebral collapse or kyphosis, peripheral neuropathy, features of renal failure, hypercalcemia signs, dehydration and confusion, and rarely extramedullary plasmacytomas. Diagnosis: blood tests, full blood count, anemia, thrombocytopenia, and leukopenia. Urea and electrolytes. This can show renal impairment. Raised ESR, hypercalcemia, serum protein electrophoresis, M protein spike, IgA or IgG, blood film, Rollex formation, serum-free light chain assay, raised light chains. Urine tests: urine protein electrophoresis, Bence-Jones proteins. Bone marrow aspiration or biopsy. At least 10% clonal plasma cells is diagnostic. Imaging: full body MRI can show osteolysis. X-ray can show raindrop skull, lytic lesions. PET-CT. This detects extramedullary or occult lesions. Diagnostic criteria. Diagnosis requires at least one major and one minor or 3 minor criteria. Major criteria: plasmacytoma on biopsy, 30% plasma cells in marrow, and elevated M protein in blood or urine. Minor criteria include 10 to 30% plasma cells in the marrow, minor elevations of M protein, osteolytic lesions on imaging, and reduced normal antibody levels. Complications: bone disease, lytic lesions, fractures, and spinal cord compression. Hyperviscosity syndrome, venous thromboembolism (VTE), renal failure, hypercalcemia, infections due to immunosuppression, and peripheral neuropathy. Management: reduce complications, analgesia, zoledronic acid for osteoporosis prevention or management, annual influenza vaccination and immunoglobulin replacement for recurrent infections, VTE prophylaxis, erythropoiesis stimulating agents for anemia, plasmapheresis for hyperviscosity, antiviral prophylaxis, and dialysis for renal failure if indicated. Disease-modifying treatment. Chemotherapy, for example bortezomib-based regimens, autologous stem cell transplant in eligible patients, and allogenic transplant rarely considered due to high morbidity. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today